Wednesday, sponsored by Baptist Health.
All right, welcome back. A massive new study involving more than 14,000 people using data from their own wearable devices like these shows that the timing of your workout could be just as important as the workout itself. Joining us now to break down these findings is Baptist Health Cardiologist Dr. Scott Davis. Dr. Davis, good morning.
Good morning. How are you, man?
Pretty good. Good to see you.
So instead of rise and shine, we should emphasize rise and sweat. So, interesting study just got published at the American College of Cardiology meeting that we have every year. This year was in New Orleans, and it looked at over 14,000 people exercising and the timing of it, like the time of day that you exercise. Is there a difference? Is there a benefit? Oftentimes we talk about the type of exercise, walking to work, going to a local gym, biking, doing some kind of household chores. This looked at the time of day and is there a benefit? And sure enough, folks that exercise in the morning were shown to have more benefit than exercising in the afternoon or evening. Now look, any exercise is good exercise. Our common theme here on this segment is get off the couch, right? But if you have flexibility in your schedule, we showed in this study that folks that exercise in the morning had like a 31% reduction in onset of coronary disease, an 18% reduction in hypertension, a 21% reduction in cholesterol issues, 30% reduction in diabetes, 35% reduction in obesity. So there was clearly a benefit. The other thing that was beneficial or new about this study, instead of using self-reporting, which is what a lot of these studies do, say, all right, did you exercise, how much did you exercise, and people kind of guesstimate or keep a chart. They harness the technology of the new wearables like an Apple Watch or a Fitbit to then track actual heart rate during the day. And if somebody had an elevated heart rate over a certain age-adjusted number for 15 minutes or more, then they were able to track that as beneficial exercise. And so it's a new way, to kind of harness the wearables that we're, using and wearing throughout the whole U.S. I mean, like 1 in 3 people are wearing an Apple Watch or a Fitbit or some kind of wearable, and then using that technology then to drive more of our studies.
Why would the time of day matter?
Right. So it kind of ties into our circadian rhythms. You may have studied that back in science where, we have these ebbs and flows in certain hormones. And a big one is cortisol levels, which surge in the morning. And so that then helps us with exercise do a better job of metabolizing and dealing with glucose and fat. So think about it like priming your metabolism early in the morning.
My last question, Doc, is this now the official recommendation for heart patients?
Well, so it's early. There's an association here. We got to do more to show causation, right? But clearly, if you have flexibility in your schedule, this study would say, hey, exercise at 7 a.m. versus 7 p.m.
And I exercise every morning around 2:20.
Proud of you. I'm proud of you.
Yes, sir.
Keep it up.
Dr. Davis, thank you for being here. If you would like to get in touch with this amazing doctor, just head over to Baptist or head over to the website or give them a call. That info is on the screen.